Yes, ma'am.
Okay. We have Asabri Deshmukh with us. Hi. Good morning from Los Angeles. Then we have Abhay, Amit, Megha, Myra, Sonal. Wow. So if few of the cameras can be open, that will be great. Asabri ji, you are into yoga. Can you introduce yourself? Because yesterday I don't think you were there. Your mic is mute. Can you unmute? I'll try. Yeah.
Yeah. Can you hear me?
Yeah, I can.
Hi, everyone. I'm Asabri Deshmukh. I'm from Pune,
Wow.
Maharashtra. Yes.
Right.
I'm doing yoga from last 15 years. I've started teaching yoga from last 3 years. I've done my diploma in yoga from Pune University.
Pune University. Okay.
Yeah. But then in between, about 1 year before, I had to go under some surgery and I couldn't do it. So again, I've started now. So I got introduced to you on FB, and then I've found some interesting things about you.
Thank you so much.
So I was a bit inquisitive to know more about it, of course. But then said, okay, fine, let us give some time and gradually I'll get to know about it.
Okay. Right.
Yeah.
Fine. Thank you so much. Right. No issues. That you can always control. Vishwa Shukla is here. I think वो कल class में नहीं थे. Myra, Amit, and Abhay. You can open your videos. So let us start with anatomy and physiology. As yesterday I have quoted, you are going to be the doctor of human body, because whenever any person is going to handle the human body, it is very essential to understand the human body, the anatomy and the physiology of human body. So anatomy, that's a science of organs. So we are going to study the difference between the anatomy and physiology. It's essential to understand the difference between anatomy and physiology, because during the interviews sometimes, or during the explanation to your own students, that is going to help you out. What is the difference between the anatomy and physiology? So when we study, we have one heart, we have two kidneys, the size of the kidney, the organ involved in metabolic system, that is liver, kidney, spleen, pancreas. It is all what we are talking about, the organs. That is anatomy. Then what is physiology? How it is different? Physiology talks about how the system and the organ functions. So functioning of our organs and systems, we talk in physiology. That means how we blink eyes, how we hear, how the neurons work, what is the afferent nerve, what is the efferent nerve, how they communicate with the spinal cord and the muscular action, eye coordination, muscle memory. This is how things work, how organs work, what makes a system, because every system has multiple organs involved. So one does one duty and hand over the duty to the other organ. That is physiology. Step by step, the functioning, understanding the functioning of the organ and systems. And what is exercise physiology? Here we can say what is yogic physiology. That is when a student will ask a question, why should I join yoga? What is going to happen? What is going to be different after 40 days? You are saying, ma'am, you are saying, sir, okay, you have this problem, you have diabetes, or you are a pre-diabetic, or you want to reduce weight. How you can claim that after 40 days, you can see the result? What is going to be the result? how you are going to claim. So you need to understand that we have to tell them, if you do yoga, if you do this asana, the impact of this asana is going to be on your anatomy and your physiology every day, this much or this percentage, and after 40 days, I claim, because the sciences say,
এখন তো 100 भी complete हो गई তখন থেকে না
का mic बार-बार on हो रहा है, please can you check? Right, thank you so much. So how the system is gradually going to improve, maybe after ligament injury, maybe the person is pre-diabetic, maybe he is getting a panic attack. So how the exercise effect on human body, that is exercise physiology. So here we will talk about the yogic physiology, how each asana is going to affect your organs and systems. So first we need to understand the anatomy of human body. So when we start with the anatomy, let us understand how the body, the layers of the body. So first layer, the deepest layer is the bone, what we call skeletal system. So skeletal system is the deepest layer of human body. After that, the muscular system. So we have a layer of muscles on our skeletal system. Then we have the fat layer, subcutaneous fat, what we call, that is just beneath the skin, and then we have skin. So let us talk about skeletal system today. We'll go very slow because I know people are afraid of science, studying of science. And that's why yesterday I have quoted, we have calculated the distance of, beneath the earth, the distance of sea and sky and everything. हमने आकाश पताल धरती सब नाप दिया, but what we don't know, what we are not aware of, maximum people on this planet is about their own body. So let us understand from the skeletal system. So first question, how many bones we have? The human body. How many bones are there? So 206 bones in human body. So remember the dialogue from MBBS, Amuna Bhai MBBS? When he said to circuit, when we break that bones, we don't count. There are 206 bones in the human body. We never counted. So same here. Let us count 206 body in a human. So let me share my screen today, and we will start with the skeletal system. I don't know why it's coming like this. Can you see the screen?
Yes, ma'am.
Okay, thank you so much. I'm not sure about this line. So let us start. Let us start understanding the human skeletal system from head to toe. So first you can see here is a frontal bone. So this is the frontal bone. हिंदी में कपाल कहते हैं इस पूरे स्कल को, so हम इसको पढ़ेंगे. So this is the frontal bone, this is the temporal bone, and right, I'm not able to remove this line. Okay, so this is occipital bone. This is the okay. Let us talk about the terminology we use in anatomy and physiology. So being a certified yoga practitioner and yoga trainer, do not use the layman language. You always going to use the technical language first, and then you can explain to the student what does it mean in the layman language or in a common language. So anterior and posterior. We are going to talk about the anterior, that means the front part of the body, and the posterior, that is a back part of the body. So when we talk about this, we are going to study both the sides, anterior and posterior. So this is the nasal cavity. This is the frontal bone. This is temporal bone. Temporal bone is here. This is zygomatic bone, and this is maxilla. So maxilla is the upper part of your teeth. Then the zygomatic bone, that is here, and this is the maxilla. This is the mandible. Mandible is the jaw, what we call in a layman language, we call it jaw, but it is a slightly movable joint. Slightly movable. Now we will study the bones and the joint. So mandible is the joint which can move slightly, so we can open our mouth in a particular range. We cannot open more. The crocodile, they can open more, but the human mouth can open slightly only because of the mandible joint. So this is the mandible bone. If we talk about the posterior of our head, our skull, that is parietal bone. This is occipital bone. Occipital is the bone where we have the eye socket from the anterior, and posterior, it is an occipital bone. And this is the temporal bone again. Now from here, we will study about the cervical. So first, foremost patients will be in your class, the females, the women suffering with cervical. There are many reasons for the cervical pain. People get nausea. People get, people sometimes feel dizziness because of the cervical pain. So what is cervical pain? And being a trainer, when anyone comes with any disease, a trainer must be well versed with which organ and which systems are involved in that particular problem, disease, deformity, whatever. So we need to understand. So always you must have heard about 7 cervicals. So we have 7 bones starting from the base of the skull to starting from the spinal, starting of the spinal cord from the base of the skull. The first foremost bones are 7 cervicals. So this is the first cervical. This is the first cervical bone, cervical vertebra. This is the second, third, fourth, fifth, sixth, and seventh. This is the human skull is the freely movable joint. That means we can move our neck towards axis, from the axis. So axis is where the one point is there and we can rotate us around. Megha, I think आपका mic on हो गया है. Please, can you mute it? So 7 cervicals. What happens when the person is complaining about cervical pain? Yogesh, can you mute her, please? Megha? Megha Shinde? Are you attending the class? Right. So basically, this is the case studies I'm going to discuss according to my experience for past 30 years. I have started my career in 1992, and then I came across many women suffering with cervical pain. Mr. Yogesh, can you mute her, please? This is very disturbing and annoying for me. Megha?
Maybe she left the phone. I think so.
She left it, but mute her ना. मैं तो वैसे भी बहुत स्ट्रिक्ट टीचर हूँ. क्लास में कोई शोर पसंद नहीं है.
मैम आप कर सकते हैं क्या म्यूट उसको?
मैं नहीं कर पा रही हूँ यहाँ से.
आप उनको एग्जिट करा सकते तो एग्जिट कर दीजिए.
नहीं कर पा रही हूँ.
One thing, ma'am, we can rejoin again.
No, let me call Mr. Yogesh. He will do it. Anybody is having phone number? Sonal, can you call Yogesh?
मैम मैंने कर दिया है योगेश जी को फोन ना. योगेश जी कर रहे हैं.
Okay, so let us talk about the case studies. Whenever any women complained, about the suffering from the cervical pain, that I can't stand in the kitchen and do my daily routine. So whenever I ask the x-rays from them, there is no protrusion of bones. That means there is no enhancement of the bone. So anatomically and with the medical sciences, if we go, a person is having cervical or not, that is only possible when we accept that case as a cervical patient. The protrusion of bone should be there. But I didn't find anyone suffering with that protrusion. So what happens exactly? Because of the overweight or overuse syndrome. Now, what is overuse syndrome? Overuse syndrome is, being a human being, we have particular type of occupation, or maybe the, I call the homemakers also, that's a full-time profession for them. So we use some particular limbs regularly for years and years to perform that particular task. For example, if a person is a traffic police, if he is in traffic police, he has to stand, he is supposed to stand for 8 hours. If I'm a professor, for past 30 years, I'm supposed to speak for 7 to 8 hours in a day. I don't think many people can use that much of vocal cord. So we have occupational hazards. If we talk about the homemakers or a female who has a lot of duty in the, making food in the kitchen and doing all the household chores, they suffer from the cervical pain. So this is because of the weakness of muscles and sometimes weakness of skeletal bone. That means vitamin D, the deficiency of vitamin D, the deficiency of calcium. So basically there is nothing to do with the bone, what we call always cervical pain, but it is related to the nerves. The nerves are under so much of compression because the shoulders sometimes protrude. If you see the obese or overweight female or male, we have more and more fat over here. And when they go under the use of overuse syndrome, it pains. And because the nerves are not able to circulate the blood properly to the axle, to the neurons and to the brain, they feel dizziness. So you are learning Sukshma Vyayama. These Sukshma Vyayama, they are going to help your student within 3 to 7 days. Don't take Sukshma Vyayama very lightly. All the activities and exercise you were doing from yesterday to today, and you are going to learn more in that series, they are going to help them out. So Sonal always asks a question, ma'am, I can't, if I won't be able to perform advanced asanas, how I can be a trainer? No, practice makes a man perfect. But your students who are going to join you for some other kind of a problem or disease or deformities or pains, they have to start from the Sukshma Vyayama. You have to hold the hand of a person who is suffering and who is not able to perform any activity and want to reduce weight, want to get rid of any kind of problem or disease. You have to handhold and start the journey from Sukshma Vyayama, from zero. But let me tell you, within 3 to 7 days, they are going to tell you, I am feeling relief. Because what Sukshma Vyayama are going to do with the human body anatomically and physiologically, they are going to improve the blood circulation. They are going to move the minute muscular structure inside the body. So we have, when we talk about the muscular system, we have major muscles, we have minor muscles, we have core muscles. So when we use and overuse major muscles, the minor muscles get into the overuse syndrome. But when we move particular muscles, particular joint at the very minute level during the Sukshma Vyayama, the blood circulation is going to enhance first and foremost. Because of the blood circulation, let us go back to the first statement of yoga, prana. So the flow of energy, the foundation of human life is oxygen. What they call 4,000, 5,000 years ago, prana. So oxygen, the more bad chemical composition can be eliminated from the systems, and the person will move towards the hale and healthy body. So that is all about the cervical. So do not think when the people complained about the cervical pain that their bones are the overgrowth of the bones in cervical region. No, you won't find. It is rarest of the rare case that the cervical bones itself are protruded or suffering from overgrowth. It is the problem with the movement of your blood circulation, nerves, muscles, and weak muscles, So that's the problem with cervical pain. Let's move ahead. This is the sternum. So you can feel sternum at the center of your body, and this bone is important because all the rib, we call it a rib cage. In some anatomy books, you will find it mentioning it as a rib cage. So all the bones, 12 bones here and 12 bones here, 24 bones, they make our rib cage. And this is very important because our heart is secured inside. The most important organ of the body is heart. Sometimes people question me, students question me, brain is important or heart is important. But I always state a person will be alive if he goes into coma. So doctors and medical sciences can work on that body to improve. But if the heart stops beating, according to the medical sciences, that is the time when they declare the body dead. So our most important organ is secured inside this cage. From here, we will talk about the clavicle bone. So this is the clavicle bone. Sometimes people call it beauty bones. So in fitness industry, in model industry, in celebrities industry, it is called as a beauty bone. Next comes the shoulder girdle. So this is our shoulder girdle. Why we call it a shoulder girdle? Because the other bone is humerus, is associated and connected from here. So actually, if we talk about the shoulder joint, So shoulder joint is a cup. That is a cup made up of scapula. This is our scapula. If you do this movement, there are two bones. They are the flat bones which touches each other. So with this movement, you can feel your scapula. So scapula is at the posterior, and this forms this hollow, cavity where the humerus, the head of the humerus, goes inside. So our head of the humerus, that is the humerus, is the upper arm that goes inside, and that's why it is clubbed. So this is a shoulder girdle. But the problem with the shoulder girdle is why we say do not lift a little baby or a small baby with their hands, because the whole biomechanically, the whole weight will be on the shoulder. So what happens during the shoulder injury? The humerus, the head of the humerus protrude out from that girdle, from that grip. And once and twice, if it is repeated with the younger child for the whole life, the shoulder will be loosened up. So can you remember when we were kids and used to play with the dolls and with some kind of a toy which is related with the body or human body? Each time when the hands are out from that doll, after 2, 3, 4 times repeatedly, that becomes the it becomes very loosened up. So that's the same happening with our shoulder. The humerus, when it comes out twice or thrice for the whole life, the shoulder joint will be loosened up. That is why we always guide young people that do not lift a child from the hands. This is the upper arm. We call it upper arm in our layman language, but anatomically it is humerus. 12 thoracic vertebra. So this is the thoracic region, thoracic cage or thoracic bones. So 12 thoracic vertebrae are at the back, which are just connected with 12 ribs. So this is the thoracic cage. Next comes the lumbar vertebra. Now, L1, L2, L3, L4, L5. Have you heard these terminology? This is, we are talking about the back pain, lumbar region. So back pain physiologically is called as a lumbago. Lumbago is the technical name of back pain. In a layman language, everybody says it's a back pain. So we divide the lumbar bones in L1, L2, L3, L4, L5. Now, whenever the student will come to you with the backache, with a back problem, and if you observe the report or the X-ray, if it is L1, L2, so it is going to relate it with the dorsal region. Dorsal region means these bones are dorsal bones. These 12 bones are dorsal. Thoracic vertebra are correlated, also called as a dorsal. So have you seen the hump? The hump here. Some people work so much, bending forward that they create the hump at the dorsal area. So anybody suffering with the humping of dorsal area is going to have pain in L1 and L2. But anybody suffering with any kind of protruded hip problem, heavy thighs, or pear-shaped body, they are going to complain about the L3, L4, L5. So L3 is the center point of the back, and L4, L5. That is, we call lower back pain or upper back pain. So you need to understand these things so that you know which kind of asanas you are not going to recommend. Like Paschimottanasana. Now we are talking about the yogic physiology. Paschimottanasana, if anybody can recognize Paschimottanasana, the stress is all on hamstrings, what we are going to study in muscular system, and the center of the back. That is the stretching point. So you need to understand the severity of backache of your client so that you can help them to improve and not enhance their injury or pain. After that, we will talk about the hip bones. So we call it hip basin. It is kind of a wash basin because these are the three bones which consist the hip area or hip joint. So these are ilium and ischium. So we are talking about ilium and ischium. This is the pubic area. This is the posterior, and same here is this is the interior, ilium, ischium, and pubis. So this is the pelvic girdle. You can find the technical name if you going to study more about anatomy and physiology. And if you consider, if you go through with many books, so you will find a different terminologies. This is a pelvic girdle we are talking about. Ulna and radius. This is your forearm. In layman language, we always have forearm. So there we have two bones, ulna and radial. And because of ulna and radial, these are the two bones. The bone of the wrist is inside these two bones. And that's why the movement is possible of wrist joint. So again, it is an axis. This is the wrist and it can move freely. So this is a freely movable joint. Next will be the, it is freely movable, but slightly freely movable joint. That is, it has a range of motion. It can range from here and here. But the fully movable joint is the shoulder joint and the hip joint, because there we have more range and we can move it more freely. So our neck and wrist, they are freely movable joint, but they are in the category of slightly movable joint because we have a range of motion where we cannot perform beyond that. After that, sacrum and coccyx. These are the last bones of vertebrae, spinal cord. What we always talk about, that these are the last vertebra, and the coccyx make the tailbone. Now, many patients are going to come to you, specifically women, suffering with the tailbone pain, where they are not able to sit on the hard surface. So in your classes, you must have a cushion which has the hole inside the that cushion. Let me show you that. Sorry, I had to rush to my third floor. So this is the cushion, and you will make your client to sit on this cushion so that the tailbone should not touch the hard surface. Now, what happens to the tailbone? Exactly during this. Sometimes people, if they fall on stairs, basketball court, during any accident, on the hard surface, then the tailbone get the crunches. It breaks. But you can't go for the plaster over there. You can't heal it very fast. So that's why that crunch always gives pain to the woman. So generally, male get this type of problem because of any accident, but women, because they have less of the calcium, less of vitamin D, when they carry baby during the pregnancy, sometimes the bone becomes very fragile, and that's the way they get the problem or the pain. So nobody understand that very much. That's very essential for them to make them very comfortable. When you just want them to sit on the floor, you must provide them this type of a pillow. Now comes the sacrum and after coccyx. We will talk about the strongest bone in the body, that is thigh. Femur is the name of the bone technically. So thigh is the strongest bone in human body. Now comes the knee pain, knee problem, patella. That is a kneecap. Some people call it chapni, some people call it katori, and so technical name is patella. That is a kneecap. So what happens during the knee pain? First, knee pain can be of two reasons. One is ligament. So what is ligament? Ligament joins bone to bone. So these ligaments which join bone to bone, they become very weak. And that's where the whole weight of the body is on the knee. They get hurt. They get pain. And sometimes it is so severe, they are not allowed to even sit on Indian sitting position. We call it alti palti, or, that is an Indian sitting position. It is not allowed to sit on the ground. If you have that type of a patient, you will go for the chair yoga. So we have the option of that also, because right now, almost the whole population has just, left sitting on the ground. In India, let me tell you, Alexandria, that in India, Indian sitting position is very common. But right now also in India also, we are living sitting on the ground. People are suffering with knee pain now more, and the ligaments are weak because we are not using them. So this is a non-use syndrome. When we are not sitting down on the ground for longer duration, longer time, then the body loses the strength in this ligament. That is the major issue. So when you have a patient suffering with knee pain, you have to make them to use the chair, allow them to use the chair initially. And after 2, 3, 4 months, when the ligaments will get strengthened, when you will make them to use that ligament and muscles which are in non-use, then they will get more oxygen flow through the blood and they will recover. So do not worry about any type of disease or deformity or problem or pain. You can cure anything. The mantra is patience and the systematic way to perform. Take time. No quick mantras, no quick fix. So if you take time, if you make your student to understand that you can cure them, but they have to be very patient and regular with you, you can cure them. Next comes the leg, that is tibia and fibula. Again, we have two bones. Because of that only our ankle can move. This is the plantar flexion. This is the dorsal flexion. So we can move our ankle, tibia and fibula. So these are the two bones where the ankle, the tarsals are set here. They are connected from here with these two bones. So this is the talus and calcaneus. Calcaneus, if you see in the posterior, sometime you will find a patient suffering with the pain in heels. Now this situation, again, it will have two reasons. One, the calcification, that is the calcium is accumulated around this calcaneus, around the heel in the layman language, and then the talus. The second is overweight. And I will count the third is the flat foot or the bow legs or the knock knees. All these three deformities of lower limbs can lead to heel pain. So you have to judge and identify what is the problem. If it is a flat foot problem, you have to include 2-3 exercise. You have to recommend them 2 or 3 exercise which they have to perform every 4 to 6 hours when they are not with you even. That is rolling off your towel. You just spread one towel and then ask them to roll from their toe. And then this will move to the functioning of the center part of the foot. Then you can ask them to lift the chalks or some pebbles or some small structure from one place and put it to the another place. So this movement will give them, give the exercise to the center part of the foot. If they have bow legs, then you have to tell them to press lie down in the, the sideways. They can lie down sideways and then they can push the roller down. So they can have a roller beneath their thigh and then they have to push it so that bone can be pushed towards inside. If they have knock knees, then they have to put the they can roll the towel and then they can put it between both the knees and then they need to spread and then they need to squeeze it so that the inner side of knee can have exercise and they can be separated slowly. Gradually, at least we can we can create some distance between them. All these exercises can help a younger kids better than the elder one, but still we can try. That's why all the teachers who are working with young students in school system, they need to check the deformities, the occurring of deformity and the correct posture of the students. But we are missing that link in our school education and people get these problems, deformities during the young age, but later on it gives them a havoc. It creates a lot of problem for the whole life. Let's talk about the toe. This is the metatarsal. These are the tarsals. You call it ankle. This is the metatarsal and this is the proximal, middle and distal. So this is all about the bones we have in our skeletal system and how each specification can create problem and how we are going to solve these problem in our student. That is very important to understand by each and every trainer. This is the first layer of our human body, which which if it is suffering with some or the other problem, protrusion or deformity, it is going to give lot of pain to a person. And when person is suffering with pain or if they have a different walking gait. Now, what is walking gait? Gait means G-A-I-T. That is a walking gait. The style of walking. Even sometimes you have to become a researcher, scientist with them. Just take a blank sheet. Just take a sheet. Ask your student to, just put the whole foot on the water and then have a mark on this sheet. When they will give the mark, you have to draw and you have to see where is the location of weight they are putting on. Either it is inside of the foot or it is the outward. You can also check their shoes, what they are wearing every day. So from where the shoe is more ruptured, you can have that analysis that where they are putting more weight. So if you fail to recognize deformity like a bow leg or a knock knee or a flat foot, you can go for the footprint. Go to and check their shoes from where it is more ruptured and which point they are putting more and more weight. That is very important. So many times you have to work to the student at the very minute level. If they are suffering with shoulder pain, you have to check the range of motion, up to which point they can perform and from which point they are getting the pain. The pain starts. What is the range of motion for them? Horizontally, vertically, forward bending, backward bending. Each time you have to be very specific to check the postures and to help them out to improve it. The more posture, the correct posture is there, less of the energy loss, less pain biomechanically. If we talk about the physics, if we talk about biomechanics, the savior of energy will be more, pain will be less, and biomechanically they can perform better asanas. Again, if we improve posture, if we help them to improve and perform better asanas, they will get more effect. So this is a vicious cycle. You improve one thing, that second will automatically improve by itself. So a trainer has to be very observant for each body. Now the question is, when you are dealing with the heterogeneous group, yes, the group is going to be heterogeneous, suffering with a different disease, having different age and the level of fitness. But as a trainer, you have to check and instruct each and every student. For instance, if we have a group of like right now 12 people, I will announce, Myra, if you are suffering with the back pain, you are not going to perform this asana. Rest of the class can do it. Now, Myra, I am giving you the improvised technique of an asana, which you can try. You can start trying. Don't pull and push your back and then go ahead with the whole class. So class arrangement is very important for a trainer, how to deal with each and every student without avoiding or neglecting any issue or any student and without any injury. So I have a record since 14th April 1992, I didn't have any injury in my class. Whether I was conducting aerobic classes for 3,000 people or yoga classes or Zumba classes, or I'm going for a group gym training, you have to be very observant. Do not miss a chance to speak up, to give the command. Do not hesitate to call the name of a student and instruct. Be strict in your classes. Announce it. Nobody is competing to anyone. If you are going for the advanced asana, or as a matter of fact, any asana, do not compete with each other. It is not a competition. It is according to your capacity, your fitness, and your limitation. That is very essential to avoid any injury in your classes. That's all from my side. Any question? Floor is open for you. Any question, please? Alex, any question?
No, I'm good with what you describe. You say them very easily to understand.
Okay, thank you.
It's a matter of reading and learning now.
Right. Now the ball is in your court.
It has to.
Right. Megha, do you have any question?
हाय मैम, कल मेरा इंटरव्यू रह गया था आपको थोड़ा सा इंट्रोडक्शन देने का.
राइट,
सॉरी फॉर दैट. मैं थोड़ा सा बहुत ही क्राउडी प्लेस पर थी, इसलिए हो नहीं पा रहा था.
राइट
जी मैम. मैम मेरा नाम मेघा जॉनी शिंदे है. आई एम फ्रॉम इंदौर, मध्य प्रदेश. आपने शायद सुना होगा इंदौर का नाम.
Exactly. One of my very refined friends, football goalkeeper for India, is from Indore. Go ahead.
जी जी बिल्कुल मैम. लास्ट मैम 2-3 ईयर से मैं योगा की फील्ड में एक्टिवेटेड हूँ, और मैं मतलब वेट लॉस के लिए ट्राई कर रही थी, बट मेरा कहीं कुछ बैक में इंजरी हो गया था, एक्सीडेंट हो गया था इस वजह से। तो मैं काफी सारे आसनास नहीं कर पा रही हूँ, और मुझे जैसे मैं स्लीपिंग मोड में थोड़ा सा मुझे टेलबोन के ऊपर थोड़ा सा पेन भी रहता है। तो लाइक मैं फिर इसमें बहुत सारी बाउंडेशन हो गई है मेरे साथ कि मैं नहीं कर पा रही हूँ।
Exactly. No issues. You will cure yourself, and you can cure yourself. And what you are going through, many women need help. We need trainers who can understand a person's problem, the medical issues, the rehabilitation issues, what they are going through. And of course, weight management is one of the other things that we need to manage. The whole population, before epidemic, the obesity was the pandemic which we were dealing with. So that is the problem with every country. So weight management, you will learn how, even with this, performing with very basic asanas, you can go ahead with the weight loss program. Doesn't matter. You don't need to worry. Secondly, today I have shown this type of a pillow. This is for your problem.
Yeah, right.
Yeah. So that you can sit on this type of a pillow cushion, and your tailbone will not be hurt if you sit on this, and then you can perform the asanas. So don't worry, gradually you will learn everything, and I hope you will be very refined trainer, and you will help other women also after recovering from your problem. So right now you are in which profession?
Ma'am, I'm a housewife.
Okay. Fine. So all the best. Start your journey with us, and we will help you out not only to cure yourself, but we will prepare you as a leader to cure other people also. Thank you so much.
Thank you so much, ma'am. Thank you so much.
Thank you. Any more question? I know India is having a dinner time now. So from my side,
One
yeah,
question,
Amit.
ma'am.
Go ahead, Amit.
Actually, ma'am, people having a little swelling area around the neck because of they're using a lot of phones, or they're working in front of computers. That's why. So, ma'am, which kind of exercise is beneficial for them?
And now you will learn gradually and slowly, because it is not one exercise mantra.
Yeah.
The pain may, the origin of the pain is,
pain is
the base
not
of the
there.
skull.
And pain is not there. Actually, the soil that this one area is swelling. It looks like swelling.
Right.
Yes, ma'am.
Right, because this is an overuse syndrome.
Yes.
This is
I
edema.
totally, yes.
Yeah, this is edema. Edema means the swellings, where the accumulation of blood flow. Blood is there and there is less of flow. So what I was talking in my lecture, the flow of blood, the blood circulation need to be better than right now. So you have to give them gradual exercises. Sukshmayama, start with the rotation, start with just touching the arm up to here, just push it back, and like that. If you can do this exercise, just place your hands here, and now push it from here.
Okay.
Yeah. So the exact point you are going to get the effect is that area only. Don't push too much. Okay. And please, trainers, do not demonstrate any asana, any step where the range of motion is too much, because you are flexible, you are into the practice, people are not. But what happens when you are demonstrating too much, people think about this is the exact angle to perform, and they pull and push themselves. That's why the injuries are too high during the classes. So just perform the regular range of motion, what a person is supposed to be. That is all. That's all. Do not perform beyond this, because this is not correct. This is over flexible body which a gymnast and a yoga trainers can have. But just think about the common man who is watching you, watching your demonstration. They will think this is the angle where they need to perform. No. So just be relaxed. Just be in the normal range of motion, and then tell them to push. That's all. If they push their elbow, then the exact center of that point will be engaged. And the sooner we will engage this, the better it will be for the edema to release from there, because the blood circulation will be there, and each time blood flow will be out from there, it will release more and more blood. So the edema, the swelling can be reduced down. Second, my suggestion is give them the ice pack. Ask them to have ice in a bag or in towel, and they can just put it here every 2 hours. Either they are sitting, whether they are sitting at home or in the office, they are doing their constant 8-hour job. Every 2 hour ice application is recommended, so that the edema, the accumulation of blood can be freezed over there, and we can stop the more flow towards that center of point.
Ma'am, on neck is okay. I mean, is the so many nerves are going around there, and this thing is not okay for icing on neck or on your back region.
No, the first aid and the injury, the protocol of injuries are application of, for the edema, application of ice is always recommended, because that will help to stop the body to flow more and more blood towards there. Because there is one phenomena of body. If we have any point which is weaker, getting edema, more blood flow will be that type, that side. So we need to stop the more blood flow towards that center. So every 2 hours when it is agitating, I think you are not able to realize the agitation of the muscles, the pain and the swelling. That will give them the nervous, agitation. So for that, calming down that agitation, it is very essential to put the nerves under the cold compression, so that for a few seconds, the blood can be stopped flowing over there. But when they will remove the ice, after that, the blood will be circulated more faster speed, and that will help to release the edema. That is how the injuries are cured.
Actually,
people,
I always recommended them. They should put this kind of pad. I mean, hot pad like this. Hot pad always, not cold pad, because nerves are going around neck or your cervical region. So I think it's not good for them.
Okay, that's your myth. When the person is suffering with heat stroke, what we suggest them? Put the ice on the water, put the ice on the head, put the ice water on the head. You have a little confusion ever here about the nerves. No, nothing is going to happen. Even when we are suffering with lumbago, gymnasts, they suffer a lot with the lumbago. Always it is a cold compression during the exercises and during when we are motion. The hot pads are allowed only when the swellings are gone. When the edema has reduced, then only you can apply the
or
hot
old injury, right, ma'am? After 10 or 15 days pain.
Yeah, but if the swelling is there, do not recommend them the hot application, because the blood will more flow. From any point our body is hot, the blood will flow more. You understand that, right? Yeah. So if in the swelling you are giving them the hot application, hot water bath or hot water application, you are increasing the edema. You will increase the swelling, because the blood flow will be more there towards the hot organ, towards the hot nerves. So always go for the cold compression, cold application till the swelling is there. Once you deal with the swelling and edema, then you can go for the hot application. Right?
So this is the myth. I mean, we can put.
No, this is not the myth. This is your wrong understanding.
Okay,
Whatever they have taught you, you have understood it wrong.
Okay.
Anytime, any injury, 72 hours, no hot application. If any injury occur in your classes, do not recommend them hot application. Always next 72 hours, go for the cold application, and that will reduce the edema. The less the edema, the injury can be recovered faster. More edema, the first body has to deal with the edema, and then it will start recovering. That's a very long procedure then. The sports injuries cannot be cured like that.
Okay, ma'am. Normally, I suggest them after 1 week or 1 week of injuries, not like in first day or second day.
It's not about the 1 week or 2 week. Is it Abhay or Amit?
Amit, ma'am, Amit.
Amit, it is not about 1 week or 2 week. It is about the swelling of a person.
Okay.
Somebody may cure with the swelling within 3 days, within 5 days. It is if the edema is there, if the swelling is there. Let us do it the cold compression, cold fermentation. After the swelling has been reduced to the minimal, lastly, then start going for the hot fermentation.
And what about the duration of that therapy?
That depends upon the swellings. That's why I said every 2 hours, because a person cannot keep the eye for half an hour, for 1 hour. So 10 minutes, 5 minutes, 8 minutes, but it should be constantly if they are using that limb, because the first aid, the formula to treat the injury is price. You know it. Yes. Prevention.
Rest, I know the price.
Ice, compression, and elevation. Now the group has to know about it also. So it has to be elevation,
yes,
compression, and then the rest. So if people are not resting and they are working during that swelling condition, so they need to, every 2 hours, they need the ice application so that the swelling should not persist and it should not go beyond, handling the situation. So it will depend upon their capacity, how much they can keep that ice on that shoulder. So recommended is 3 to 6 minutes to 10 minutes. That's all. But every 2 hours, that's important thing. What people do, they go for after 8 hours, after 10 hours, they just apply once and that's all. That's not a treatment. The treatment has to be like a treatment, like we eat medicine, we take medicine, we pop pills every 4 hours to cure ourselves from any kind of a fever. The same way we have to treat it.
Okay. Like 2 or 3 days in a row.
Yeah. Any question, Abhay, Sonal, Alex, Anu, Myra?
No, ma'am. First I will read. Then if I have any question, then I will ask you tomorrow. Sure.
Anytime.
Okay, thank
Sonal,
you.
any question? No? Okay.
No, ma'am.
Right.
Ma'am, I have one question.
Yeah, go ahead.